Good morning, and welcome to Look and Feel Your Best. This is a show where we're going to tell you how you can look your best and in turn feel your best. I'm Gina Birch. Dr. Patrick Flaharty is the main man here. Mm-hmm. He's the medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. Good morning, Dr. Flaharty.
Good morning, Gina.
Always good to see you.
Good to see you as well.
And I'm going to go ahead and just to let you know, if you're new to the show, Dr. Flaharty's offices, again, where I told you, are all over Southwest Florida, but you can always go online to azulbeauty.com and through the course of our conversation and maybe see some before and after and see some of the things that we'll be talking about today.
Yeah, the website's great because it has a lot of information on everything we talk about in the show.
Right.
Sometimes we're talking about new trends that may not be on there, but most of the technologies, treatments, and products and things we discuss are in greater detail on the website. So
you also have a book that I know there are links to on the website to buy the book. You've got two books actually right now.
Yeah.
And I like to say, you know how they have those something for dummies, and I know it's not that way, but it's kind of like it's just a great resource of all of the things that are out there, and it breaks it down into layman's terms for all of us to understand a little better.
Yeah, Look Younger Now is the first book, and it's really a patient's guide to facial cosmetic surgery, and then Young Again is the one we just published last year. And that's just sort of an updated version. Interestingly, as we'll talk about today, things are changing so rapidly in our field that within 5 years of the first book, there was a number of topics that are really important topics that, were so new they weren't in the first book. So, about half of the second book is, new technologies, new treatments that weren't available even 5 years ago.
Wow, that's crazy.
And it continues to evolve at that speed. So,
yeah.
We probably just need to do a ebook.
Yeah, there you go. And just update
the ebook, yes.
Well, when we do these segments, you're always so good about educating our listeners, and people come in all the time, and they know their face has changed, and they know they look older, and they know they don't look like they did when they were in college or high school or their 20s or teens, and a lot of times they don't understand why. And I always think it's good to know what has happened, so then when it comes to correcting it, they can understand what you're proposing and what you are doing. So tell us basically what happens when we age and all those changes that we see in the mirror that we're like, how'd that happen?
Yeah, I'll do that. And, that's a good starting point, because really, even in consultations, when people come in for a consultation, I mean, sometimes people come in with a very clear idea of problem area and something they want to address, but a lot of times they're feeling like they're just looking a little older, right. And it's sort of a general kind of a feeling about the way things look. And so our consults tend to be very educational. We really look at everything from the skin to the subcutaneous fatty layers to the muscle structures and to the bones, and evaluate everything. And then based on that, we can kind of educate the patient as to what's going on, and then what the treatment options are, what can be done. And so that's really helpful because then that gives people kind of a roadmap that they can look at. And nowadays, there's so many options to make you look better. It's not just one thing or two things. You can everything from skincare to cosmetic surgical procedures, and a lot in between with lasers and injectables. There's so much you can do. So the starting point is always understanding what's going on, and then knowing what can be done to reverse some of those changes.
Right.
And in the face, a big part of facial aging, which had been ignored for many years, mainly because we didn't really have tools to fix it, was volume loss. Which is really just mainly fat loss from the face, but also our bones of the skull and the face do remodel, so we have a net loss of bone over time, over the course of our lifetime, and the muscles do shrink as well, so we lose a lot of volume from the face. At the same time, the skin may actually stretch. And so you get this...
Because it's not filled up like it used to be, right?
Well, yeah, and because it could stretch as well.
Yeah, it just breaks down.
Yeah, you get redundancy of skin. So you got these two factors going on. You've got this deflation or loss of volume, like a pillow that's lost its stuffing, and then the pillowcase itself is stretched, which creates more looseness, or as we like to say, like the balloon that loses air and gets a little bit loose. So
I like the pillowcase analogy, though. That's a good one,
like
too.
That, yeah.
I see it.
Yeah, so So that can lead to, subtle things like, in your 30s, you might see a little bit of dark circle under your eyes, and you might say, gee, I didn't have that. Where is that coming from? Well, that's that little bit of volume loss in the face is resulting in some hollowness under your eyes, because that's where it's going to show up first. Just with gravity, those fat pads are going to be kind of pulled down, and so the first area, you're going to see a deficiency is like right under the eyes. Mm-hmm. And then as it progresses from there, you might see some hollowness in the upper lid or temple area, where you start to get, rather than a nice full sort of round convex temple, it's concave. You see some hollowness. You can start to see some of the bony anatomy around the eyes, like the cheekbones become more visible because that soft tissue envelope dissolves, and you're getting some hollowness. So hollowness under the eyes gets worse. Hollowness or flatness of the cheek starts to become more apparent, where you lose that sort of rounding, that youthful roundness to the cheek area. It becomes very flat. And below the cheekbone, it can get very hollow too, especially in people who are athletic and naturally thin anyway,
right,
and don't carry a lot of extra weight. And then with the aging, they're losing more fat, and so they get very, very hollow in the face. That's a very challenging group of patients who are really fit, but right, the face ages faster because of volume loss, fat loss from the face.
Yeah, and even when you are not necessarily fit, but you're getting in shape, and a lot of times you see people who lose a lot of weight, and there's a point where you're like, oh, you almost look gaunt. And it's in the face because that's where it shows at first, right? And then things kind of sometimes even out, but there's still things that aren't ever going to even out, and that's your bone loss and your muscle loss, because that's gone.
Right. Yeah, so that's a big problem. And then we do lose bone too, and that can show up as flatter cheeks, and narrower jawline. You start to resorb bone along the jawbone, and jawline becomes thinner and more narrow, so you lose some of that structural support for the lower part of the face. And then that can lead to sort of the soft tissue collapse around the mouth, where you get the what we call nasolabial folds or labiomandibular lines, some of the big lines around the mouth, as well as wrinkles and creases of the lips and chin area from loss of that normal soft tissue pad. Mm-hmm. And at the same time, we're down here in Florida especially, you're getting some sun damage and some aging of the skin, and that can show up, just with some dryness maybe in your 30s, and then maybe a few sunspots start to show up.
And they bring friends.
And they bring friends.
Like, come on, man. The party's not here.
And then those smile lines that, around your eyes that are just sort of there when you're smiling when you're young start to, linger a little longer. You see them in the mirror when you're washing your face at night. So you start to see some lines and creases and etchings. And so, the skin changes too, and that's another one of these subtle early changes we see with aging of the face. And so, again, understanding all these little areas, now we have a lot of tools to address those, and many of them are non-surgical tools. So that's kind of the topic of today. We, talk about the Azul Liquid Facelift, which is using injectables, but I think we're going to add to that, some of the skin treatments we can do as well, which are non-surgical.
Well, that's what's so cool about this. Now that we know how the face ages, and now it makes sense, we can pump it up and we can get rid of some of the wrinkles, and we don't necessarily have to go right to the facelift. There are things we can do, and that's the Azul Liquid Facelift. And that's kind of the interim step before going into surgery, and it really works. I mean, it takes care of the lines, and it takes care of the volume loss through a combination of injectables that you do.
Yeah. And interestingly, when you kind of look at these two things, like surgical versus non-surgical, it's nice options for people to have. I do have a lot of patients who come in who want the one-time only rejuvenation, where we're going to do, let's say, a endoscopic brow lift, eyelids, face and neck lift, fat augmentation. So fat augmentation is the surgical way to replace that lost volume using your natural fat, which we harvest from the abdomen or flanks with very delicate liposuction. We spin it down in a centrifuge to concentrate it. We use that really potent concentrated fat to rebuild the face very gradually from the deeper levels. And it's a one-time only treatment, and we can get tremendous rejuvenation of the face by restoring that lost volume using your own natural living fat. So that's a very attractive procedure because it's one time, it's living tissue, it's natural, and it'll last, for many, many years. And a lot of people will opt for that reason. It is actually more cost effective than fillers because you're only doing it once. Although you may add some fillers to it later,
and it's your own natural body.
Yes.
Yeah.
So there are people that will look at their options and go, yeah, that makes sense to me. I want to just do it as a one-time only treatment, get the best result. Have one procedure and a week or two of recovery, and then I'm done. But, the alternative is, chipping away at it using things, like fillers, Botox, skincare, the BBL and halo lasers. And that obviously appeals to a lot of people, too, because you can do a little bit at a time. You have little or no downtime with those treatments. And, so you don't have to miss time with work. And, you can kind of do a subtle transformation over time. But the beauty is that now we have options. People can choose the path that makes most sense for them. And sometimes it's different times at your life. Younger working people tend to want to do things that are going to be no downtime, not as expensive. Patients will get to a certain age where maybe it's a breaking point in their life where they've just retired or out of a long-term relationship, and they have a period of time and they want to address some issues. And so addressing them all at once makes sense for those patients. So, but it's good to know that you have, these various options that can fit different lifestyles.
Okay. So for the rest of this hour, we're going to concentrate mostly on the liquid facelift and how it works and how it can really turn back the hands of time when it comes to aging. And then we're also going to throw in some really great new technology that takes care of what you call the envelope, which is the skin itself. And that's the halo and some of the amazing laser kind of treatments.
Yeah. I think it's we'd be remiss to talk about like Botox and fillers, and even Botox, which we'll talk about next, really can help smooth the skin by shrinking pores. But when you add things like a BBL halo to that, you can get rid of the reds and browns and really make the skin look great. And again, without downtime, without surgery, which is great. Yeah.
Okay. Yeah. So we're going to take a quick break here, and I'm going to go ahead and give you the phone number and the website again. And so you can check this out and pull it up on your computer while we're talking if you want, or just wait until Monday and then do it and call for a consultation after you hear about more about the liquid facelift. But 239-415-7576 is the phone number, and azulbeauty.com is the website. We'll be right back to talk about the liquid facelift with Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty, Medical Director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And I'm Gina Birch. This morning we're talking about the liquid facelift. It's a way to cheat the OR a little bit longer. So you're getting a facelift, but you're not getting all the bells and whistles, the traditional one that Dr. Flaharty is so good at doing. This is one that uses, as you said, liquid and injectables, Botox and fillers.
Right.
And it's a really cool way to do it. I mean, it works wonders, really.
It does. And, as we talked about in the first segment, so much of facial aging is volume loss and deflation of the face. So, when you think about it, as you add volume back, whether that's, through injectables in the liquid facelift, you are actually lifting and filling. So you do get some lifting and tightening and filling of the areas, and the cheek is a perfect example because we tend to get very hollow, flat cheeks and hollow cheeks and sagging and some, dark circles under the eyes. And you can use injectables to correct that very quickly in the office, and it really makes a huge difference immediately. And so, it is a lift by filling. It's a liquid facelift.
Okay. Yeah. One of the key components to the liquid facelift is Botox. And, people hear that word a lot. They know it. Some people are still a little frightened by it, and some people know exactly what it is because they are worshipers of the Botox, and they know how it just is like magic when it comes to erasing lines. So, but let's just give a little education on what Botox is.
Yeah, so, part of what we see as we age will be lines and creases on the face, as we talked about, and crow's feet are a perfect example. We smile or squint in the sun. People who play tennis a lot will get prominent crow's feet from squinting in the sun.
You said you got it from studying in college because you were so intent.
Frown line between my eyebrow, But these areas, the crow's feet at the corners, the frown line between the eyebrows, the horizontal lines in our forehead are all what we call dynamic lines. It's movement of the face that creates a line. And when you're young, you move those muscles, but the skin is so pliable and youthful and elastic, it just springs back to its normal condition, right? But after years and years of doing that, you start to break down the collagen, and sometimes the skin doesn't, come back to its full smooth surface, and you'll see these lines that are what we call dynamic lines from movement. They're there when you're moving. They'll start to stay even when you're not moving, like the frown line between your eyebrows, right? It just starts to stay and become more visible as they get deeper with age. So Botox is great for these types of lines, and what Botox does is botulinum toxin type A is a neurotoxin. It sounds pretty scary, but really what it does is it blocks the conduction between the nerve and the muscle. It actually blocks the receptor on the muscle so that the neurotransmitter won't activate the muscle. And so it's a adjustable effect, which means you can do a tiny bit to weaken a muscle a little bit or completely weaken the muscle depending on what you're trying to achieve. Between the eyebrows, generally if you get those 11s or a frown line between your brows, a little bit of Botox in that region can weaken those muscles and soften that line, get that line to go away. The horizontal lines in the forehead we can make go away, as well as the crow's feet. So those are the most common areas we use it. And it works really, really nicely. This is done through a very tiny injection because the neurotoxin is actually diluted in saline. It comes sort of freeze-dried, and you only need a small amount of saline to reconstitute it, and then you just put small amounts of this into these muscles, and it will weaken the muscle and relax it so that the crease of the skin relaxes over the top of the muscle, and it just takes those away. And it's really kind of miraculous. The first time you do this for people, it's really fun because they just are amazed at how much younger they look and de-stressed and Yeah,
you did it to me, and I was one of those people who, frankly, was a little I don't want to say scared, but cautious about it for many reasons, And I'm an animated person. I do TV and radio, and I want to make sure that when I'm trying to express myself, I can. And you said, no, we can do it. There are ways you can do it and be subtle about it and make you look better, but still natural and be able to use your forehead. And it, like you said, it was miraculous. I thought, why have I not been doing this all these years?
Yeah, it doesn't make you look different. It just takes away, it just erases the lines, so it's really great that way.
No, but I do have a question, though, because I've seen when some people do this, and I know it goes back to technique, and maybe you can help address this, that they will look like a Joker. The middle just goes pointed up in the middle of the eyebrows, and it's like, oh, you just had Botox. What causes that, and how do you avoid that?
So, muscle physiology is really, really interesting, and so there's a lot happening when when you're using a product like Botox. So you can weaken a muscle by injecting a little bit of Botox, or the newer form of Botox, Dysport, which is we use a lot. It spreads a little bit quicker, and that's kind of my preferred technique. But anyway, so there's more than one product, which is important to know. But the original was Botox. Everybody uses that name. But if you weaken a muscle, if you weaken it partially, so like in the forehead, there's two big muscles that lift your eyebrow. If you block the entire forehead, those muscles will be relaxed. All the creases will go away. But a lot of women prefer an arched brow. They don't want a flat brow. So flat brows look more natural. So for men, it's a little bit easier. You just treat the whole forehead because you don't want them to have an arched brow. That looks funny. But for women, having a little arched brow can look good. So you want to preserve some of the muscle over the outer brow so that will still lift. And what will happen when you weaken the inner part of that muscle, because the brain knows, okay, half or 2/3 of this muscle now isn't working because of the Botox, the remaining third will actually try harder to compensate. It's called muscle recruitment. So it's recruited to be more active because the other part of the muscle is rendered inactive. And so you'll get this excessive activity in that outer muscle, and that's how you can get a brow lift, but that's also how you can get excessive lifting of the brow, what we call the Spock brow.
Yeah, the Spock. That's a good word. Yeah.
So yeah, that's the common term for it. Actually, if you look that up in the dictionary, which I did, it shows a picture of Leonard Nimoy, which is it's so
that's awesome.
It's so great. But when you see that, that's not a natural brow position, and
right.
That's an easy thing to fix. When you do Botox, you'll see the full effect in 2 weeks. If somebody ends up with an unnatural contour of the brow or any asymmetry in the brow, you can add a little bit more to even that out.
Okay.
So it's an easy fix, but as you know, because you do see that out there, some people have the treatment and then they're running around for several months with this unnatural, hiked brow that doesn't look quite right. But that's why Botox is, there's a lot of nuance to it. So knowing, how to do it, how much to put in each area. And every single person is a little different. Everybody's muscles are different sizes, shapes, and different levels of activity. What's interesting is muscle physiology. Muscles aren't either active or quiet. They're always active to some level. And so you're altering the activity of a muscle. So as you can see, it's, it can be very elegant and nuanced in the way you do it. And it has to be very individualized too. Obviously, when you're working with a patient, once you find a pattern that works, you stick with that. But getting to that can be a little bit of trial and error as you see what works best for that patient.
And I know you keep notes about that with your patients.
Right.
So when you were talking about, how the muscle activity and, you're putting it to sleep and but your other muscles kick in and this type of thing. So I know from being injured in the past and things, when you don't use a muscle, it atrophies and it gets smaller. Anyone who's had a cast on their arm or leg will see, what just happened to one calf. And that is kind of what happens to the muscles in your face when you start doing the Botox on a regular basis, right?
Yeah, that's a favorable effect because the bottom line on that is, let's say you have big frown lines between your eyebrows and that's created a really deep crease. And let's say you've done, you do Botox a couple of times and that crease goes away, which it will. You're also weakening those muscles. And so, Botox, you say lasts 3 to 4 months, and that's pretty accurate. But once you've done it a few times and you've rendered that muscle sort of inactive, and so let's say you've done it 2 or 3 times in a row, so it's been a year and a half, that muscle will be a lot smaller and weaker because it's not frowning, it's not moving all the time, it's basically at rest. So maybe it'll shrink down to about half of the size it was when you were frowning all the time, which means even if you don't do Botox right away after it wears off, the muscle doesn't activate fully and you don't get that big crease. So the point of that is that you can actually stretch out the interval a little bit after you've had Botox a few times. I have a lot of patients who come in every 6 months just because that's a logical time, twice a year, because then we can look at, okay, do they need any fillers at that time? And obviously at 6 months, you definitely would need to repeat the Botox because it's going to be worn off by then. But again, if you've done it fairly regularly, you can get by with that, which is nice because then you're not in as often, you're not spending as much money on it.
No, it's nice to know there is a cumulative effect. There's another effect that works as well. So now I don't have the creases on the forehead, but something else happens that the skin actually looks better too.
Yeah, so Botox has other effects as well, and one of them is that it shrinks sebaceous glands, and there's some, first time I heard about this was a Chinese plastic surgeon who did these micropunctures where they put tiny amounts of Botox in the surface of the skin through these tiny, tiny little needles just for the sole intent of smoothing the skin. So people who have kind of sebaceous skin where they have big pores, you can shrink those down and smooth the skin. So kind of a tedious treatment, but even if you're doing it deeper into the musculature, you're going to get some diffusion, you're going to get smoothing of the skin. So the skin looks better not just because the muscles aren't moving and the creases have gone away, but it also does truly smooth the surface of your skin. So it's another beneficial effect of Botox that people may not be aware of, but you can definitely see the improvement. I have a really good story about Botox. There's a guy who I've treated, and he was in just the other day. We were talking about treating, and he had really high forehead, really in the sun a lot, big lines in the forehead, big crow's feet around the eyes, and we did Botox for the upper face, and I did some fillers because he had some flat, hollow cheek area too. But it was funny because he said, it was funny because I was out working in my yard and my neighbor came back from up north and he was kind of ignoring me, and I thought it was kind of strange because, we had been pretty good friends the last winter he was down. And finally I just was like, well, I'm just going to go find out what's going on. So I went up and said, hey, what's going on? Why are you kind of standoffish? She goes, oh my God, it's you. I can't believe it's you. I didn't even recognize you. I thought you were like a younger guy.
Oh my gosh.
He said, I thought your wife had got divorced you and found a younger boyfriend.
That's awesome.
So it's just so funny because the guy didn't recognize him, and it was just taking away those creases in his face made him look that much younger.
Wow.
It's pretty, those are, hear those things all the time. It can make a big difference,
Before we take a break here and move into fillers, we've really concentrated on the forehead and the eyes. Quickly, what are some other areas of the face that Botox works for?
So vertical lip lines, small dose on the upper lip can help. Corners of the mouth, it can lift the corner, take away that downturn at the corner. Marbling of the chin, where we get some roughness of the ball of the chin, works great to smooth that area. And then even in the neck for vertical and horizontal bands in the neck, we can use it there as well. So there's a lot of areas you can use Botox to help shape the face.
Awesome. Okay. We're going to take a quick break. We're going to come back with part 2 of the liquid facelift, and that's fillers. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Again, he is the medical director of the Azul Cosmetic Surgery and Medical Spas in Southwest Florida, azulbeauty.com. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Again, Dr. Flaharty is medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And we're talking this morning about one of his signature procedures, which is the Azul Liquid Facelift. And it's using injectables to give you kind of like a mini facelift. I don't know that that's the right term, but it gives you a facelift basically without going under the knife.
Exactly. As we mentioned, so much of aging is volume loss. And so when you start to replace this volume using fillers to fill in dark circles under your eyes, or lift the cheeks, or fill in the temples, or soften the creases around the mouth, these can all make us look tremendously younger and really do give us an injectable facelift.
Yeah. So the liquid facelift has a couple of different elements to it. We just spoke a lot on Botox and how that helps get rid of the fine lines and creases. But then the next thing, which you always talk about, is one of the keys to aging is the volume loss. So I've got the Botox injected between my eyebrows. What is that called? The glabella? Glabella.
Yeah.
And so it's great. Now my muscles aren't going to contract and make it worse, but I've had these lines for 10, 15 years, and they're still not going away. So that's when something like you'd hit the 1-2 punch with the fillers.
Right, yeah. Okay. So sometimes those vertical lines between our eyebrows get so deep that Botox alone isn't going to solve them. Botox helps because you're weakening the muscle and you're not making it worse. But sometimes that crease becomes too deep, and so then we use fillers for it. But we can always make it go away with a combination of Botox and fillers. But fillers will actually physically, efface the crease, fill it in so that it's, it smooths that area. So,
okay.
And really, Botox, in the 90s, became really popular for cosmetic use. And then fillers, the whole filler market has exploded really since that time. When you think about it, Botox was great for the upper part of the face. Everything looked really smooth. The original filler was bovine collagen, which was approved by the FDA in 1983, but was a very watery kind of a filler, which really didn't work very well. I mean, it could give you a little bit of volume, but it usually only lasted a few weeks.
So it'd be like for a special event kind of thing, go get plumped up and then it would go away?
It was good for like lip augmentation for a few weeks, for Hollywood set, for Academy Awards, things like that. But nowadays, it's amazing what we have, not only really safe and effective and long-lasting fillers, but very sophisticated fillers. The field just continues to evolve. I remember when we got some of the first fillers, Restylane and then Radiesse, and it was like, wow, now we can do Botox for the upper face and take away these frown lines around the mouth and lines and creases, and we really had some powerful tools. But since that time, they've gotten so much better, because they become much more sophisticated.
Mm-hmm. Yeah. Well, and that's what's really cool about it. It would be like, let's say you're painting and you've got blue and you've got 10 shades of blue. Yeah. So it's kind of like that with fillers, right? You've got all of this, the same color, but there's so many different variances that you can use for whatever your goal is. If you something a little more, like you said, watery, or something that's a little more subtle.
Exactly.
You really become an artist with this.
Well, right. And some of this was trial and error as we all began using the fillers that were available, FDA approved, and started to see where they worked best and where they didn't work as well. And then companies have innovated to develop new fillers. But an example of that would be lower eyelids. We get dark circles under our eyes, and fillers work great to correct that. And that can be a permanent solution. So that's a really powerful area to treat, because it can happen in patients even in their 20s. Now, obviously, they tend to get worse over time, but once you fill it, which is easy to do right in the office, we use a technique called the cannula technique, which is really nice. It's a blunt-tipped instrument, so you can do this very atraumatically and nicely correct it with really little or no downtime at all. Mm-hmm. But it's an area that's, because the skin is very thin there, and the skin is, it's easy for the skin to swell. Because these fillers do attract water, it can plump up. And if you're putting it in a lip or deep into a cheek and it plumps, that's fine. It just gives you a little more volume. But if it's right under the eyelid and it plumps too much, then it can go from a hollow dark circle to a bag. And obviously that's not really a desirable outcome, right?
No, we don't want bags.
Don't want bags. So we now use fillers that are called less hydrophilic, which means they have less affinity for water. All these hyaluronic acid fillers, that's the most popular class called hyaluronic acid, have a high affinity for water, but some more so than others. And so in an area like the lower eyelid, we want to use a filler that's less hydrophilic, that causes less swelling, so that, when you finish, you're going to get pretty much what you see. And that's important. So that would be an area. In the lips, it's just the opposite. You'd like a little bit of fill to go a long way. So having a little bit of plumping can be okay, or certainly in the cheek where you have a large volume area. Again, lips depending on what you're trying to accomplish, but a little bit more swelling is not typically a problem as long as you know how to factor that into your treatment plan. With these hyaluronic acid products, it's important to recognize that they are reversible. We have an enzyme you can inject to dissolve it. That's very useful and very handy. There's a lot of fillers being done. So if somebody has fillers under their eyes and it causes too much swelling and it creates some plumping, you can inject a little bit of an enzyme to dissolve it, and that takes care of it. So It really has this great control and safety mechanism.
Right. Gives you a little peace of mind when it comes to that. So let's break down some fillers a little more. I know that, under the eyes, you've been using it for some time, and that just evens out that little pocket there and makes everything look smooth. But cheeks have been the big deal lately, right?
Yeah, cheeks are really powerful because we all lose volume through our mid-face, and when we talk about volume loss in the face with age, where it really is most evident is lower lid cheek area, dark circles, flatness of the cheeks. And when you restore the volume in the cheeks, which is really a very safe and effective treatment, you're really doing just a few little injections deep to your cheekbone. You basically are putting the filler down on the bone, which is lifting your natural cheek, which obviously gives you a very natural result. And it is like sculpting, really. It's really very fun to do, because you're shaping the face to, create this, beautiful, youthful cheek area. But it really comes down to just a couple of little injections and then just sort of molding the filler into place. And it just gives people this instant rejuvenation almost at any age. And when I say that, I mean really any age. Somebody could be a little bit flat in the cheeks in their early 30s. And I've had patients, 95 who've had fillers who, look great. They're just, at 95, you've lost a lot of volume from your face. You tend to be very flat and hollow. and just putting a little filler in there gives them sort of those fuller cheekbones that make them look, younger and more healthy.
Yeah, when you fill up the cheekbones, not only does it make the residual effect is that it tightens the skin. Your eyes look better. Everything underneath looks better because it just fills that skin up a little more.
It's an important highlight of the face.
Yeah.
That's correct. When you get thin in the face, everything is drawn and pulling down, and you can see that through the cheek with these hollow areas that go from the inner corner of your lower eyelid down to, the jawline. And that just makes us look tired or gaunt. And when you fill just with a little filler through the cheek, you can get that nice lift. And then the line is up. It goes from the corner of the nose up toward the outer corner of the eye. Everything is kind of upswept, and it just gives you that fuller, more youthful, healthy appearance to the cheek. And like I say, it just makes everybody look healthier and younger and happier too, because they don't have that sort of drawn, sad look to the face.
Another important part of the face to talk about when it comes to fillers, lips. And that's another one of those areas that people are like, ooh, I don't know about that. I saw someone who looked way overdone, and when they're overdone, it's very obvious.
Yes.
But you can do it and just everyone said, you look fresh. You don't look overdone.
Right.
I would never have known you had anything done to your lips.
Right. So, just to mention one other thing about the cheeks,
Okay.
so we have fillers that are specifically approved and used for the cheeks, which are thicker, heavier fillers. And so in the cheek area, you want sort of a heavier, thicker filler because it's going to be very deep. You're not going to see it. You're not going to feel it. But you want it to lift the tissue and stay a long time. And those fillers can last a year to 2 years. And so that's where the technology has gotten better. They're hyaluronic acid fillers, so they're safe, but they're made to be thicker and denser so that they do a better job of lifting and shaping the cheek, which is great. Lips, what really works great for lips is what I call the mini lift. Almost everybody looks great with a little bit volume in the lips. But a lot of people are very apprehensive about it because, of course, you can see patients who are overdone. It's really easy to tell when somebody's had too much filler in the lips because it's not natural. Same thing with the cheeks. You can see overdone cheeks, overdone lips. Anything that can be done can be overdone, and that's that happens in the world of cosmetic surgery, both on face and body. But in the face area, what we see with the injectables is lips and cheeks. But that's completely avoidable. It's just good judgment. And most of the time, if somebody is sort of interested in the lips but kind of apprehensive, we do what we call a mini lift, where I'll just use a little bit of filler just to give them. There's 2 pads in the upper lip separated by the Cupid's bow in the middle. If you just put a little bit in each of those pads and one in the center of the lower lip, that 3 little injections just plumps those 3 areas, and those are really the kind of highlight areas, and it looks really, really good. And almost always patients will come back and go, that was great. Yeah, I want to do a little more next time. So you just start slowly, and obviously respect the natural contours of the lip, respect the natural shape of the patient's face. If somebody's, really a tiny face, you don't want to give them big lips. That will look unnatural.
Right.
And, there's younger people who are ambitious to do more, but, you have to kind of try to talk them down on that as if you can.
Right.
Just to say, hey, listen, let's try to keep this in proportion so you look really pretty.
Right.
Most patients who are a little older, are, want to look natural. They do not want to look artificial.
Right.
I think some of the younger kids, are, happy to push the edge of the envelope and don't care as much. But, most people, we tend to do more of an aging face practice. So we tend to see patients who are 40 and above. And that set generally don't want to look artificial. So they want it to be natural.
They just want their youth back.
Right.
In more ways than one. Well, before we take another break here and go to the next element of the liquid facelift fillers, again, we talked about the cheeks and the eyelids and the lips, but they're used on a number of other places on the face to round it out and make it look full.
Right. Yeah, we can talk about some of those key other areas.
All right, you want to do that when we come back?
Sure. Yeah,
all right. Yeah. Let's not rush it.
Okay.
We got a lot to cover here. All right. So you're listening to Look and Feel Your Best. Again, Dr. Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas. You can look it up online during our break at azulbeauty.com. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. This morning we're going into detail on the liquid facelift, the Azul liquid facelift. And this is where Dr. Flaharty uses a combination of products and techniques to add volume to the face to get rid of those fine lines and wrinkles and really make you look, I'd say, 10 years younger for some of these people, right?
For sure. I mean, it's really can really turn back the hands of time. It's and, you know, fine lines and wrinkles, we started with that, but obviously now we're volumizing, you know, reshaping the face as we talked about, you know, restoring volume in the cheeks. And we hadn't talked about some of the other areas, but temples is another big area. You know, our temples get very hollow with age.
I never even would have thought, you know, until I did this show that I would need to fill in my temples. I mean, you know, the other places are obvious, but...
Yeah, if you study the face, you know, and the aging of the face, you'll see the temples become hollow with age. And, you know, the cheeks being the most important. There's sort of primary areas. I mean, if you look at a face straight on, which is the most important way, because that's how we interact with each other, you know, things like dark circles and flat cheeks become very evident, or creases around the mouth or lip creases. You know, those are the things that bother people because they see them front and center in the mirror every day. Once you've corrected those areas, though, you know, temples can be very, very powerful, because that, if you look at a really youthful face, it's very convex from the forehead through the temples to the cheeks is one smooth transition. There's not this hollow concavity there. And that concavity of the temple makes us look a little bit aged or tired or gaunt, and none of which are attractive features, you know. So a little bit of filler in the temple can be really helpful to give you, again, a more youthful shape to the face. It can also lift the brow a little bit laterally. So I call that like a secondary area, because usually we're going to start, you know, you want to prioritize and use the fillers where they're going to be most effective. And I think lower lid cheek and the areas around the mouth tend to be the most popular areas.
Okay, so going on that theory then, you know, that the youthful face is a little more round and cherub-like. So you just talked about the part around the eye. So then we get down around the chin, because sometimes I notice, and I've noticed it with myself, that the chin seems to get a little more pronounced or a little pointy. And that's, again, because we've lost volume on the sides of it?
It's partly because of lost volume, and the chin itself can protrude a little bit more with age. But it's, you know, that's obviously a little harder to fix. But but filling in around it to blend in is not. That's easy to do with fillers. So yeah, it's strengthening the jawline by adding volume along the jawline can give you a kind of a wider, more youthful jawline and face. And so, you know, if you look at a face and morph it over time, you know, there's so much loss of volume, you really can add filler everywhere and create, you know, a more youthful shape. And that's what we do with fat augmentation, which is our surgical procedure. We'll put 50 cc's of fat in, and we'll fill the temples, upper lid, lower lid, cheeks, lower cheeks, jawline, you know, chin, lips, everywhere. And so you can do that with fillers as well. You know, typically you're not going to do that all in one day, but you can gradually add filler and kind of rejuvenate the entire face just by using injectables, because virtually we lose tissue in all areas of the face. And so adding volume back, I mean, the key is how to get the best bang for the buck, you know, how to get the best result, you know, with the fewest number of syringes of filler. And so we tend to prioritize based on that. And obviously patients' interests, you know, are, you know, first and foremost, but most of the time after we've discussed it, you know, we kind of all agree, okay, let's get rid of the dark circles, let's lift the cheek, let's soften these lines around the mouth, and then next time we'll do the temples and jawline, and you can kind of build it up over time, which is nice. Then that nasal, one more area that I think about is that nasal labial fold. So yeah, what's interesting about that is that's an area we do treat that a lot, but you know, it's a little bit less emphasized now because we all have nasolabial folds and they're normal. You know, you don't want them to go completely away. You just don't want it to be real deep or prominent. But filling the cheek kind of helps with that sometimes, does help right? with that. And so that's when the key features, when you fill the cheek, you're lifting the cheek, and that softens that nasolabial fold and reduces the amount of filler we have to use in that. But we do use fillers a lot around the mouth, and it's the same strategy. You know, we use the deeper, heavier fillers to fill fill in the deeper depressions or heavy folds, and then more of a thinner filler for the more superficial areas. And so we call that a layered approach. You can layer, start with the heavy filler, fill in deep. You might strengthen the jawline and fill in some of the deep folds, nasolabial fold or labial mandibular line, some of these deeper folds around our mouth or at the corners of our mouth. And then finish with a thinner filler that's going to do the fine lines and creases and maybe add some volume to the lips. And that layered approach works really, really well to rejuvenate the whole area.
I know it varies from person to person in different areas of the face, but how long can a typical patient expect this volumizing, these fillers to last?
So the great thing about fillers is you might say, oh, well, gee, they're temporary. I don't want to do that. And I do hear that a lot from patients. I want something more permanent, and that's fine. But, really, you are making some permanent change every time you do a filler. If without fillers, your face is getting thinner every day, the wrinkles are getting deeper. I hate to be so optimistic here.
Thanks,
but
Doc.
once you start doing the fillers, though, you're replacing volume. By putting in the fillers, you're stimulating collagen production.
And that's key.
Key. And you're effacing creases that have been there forming over many years that are only going to get deeper if you don't do that. But once you start filling them, you're actually stretching it in the opposite direction. You're softening it, and that can be a more permanent effect. And so I see with repeating the fillers, some creases go away and you don't need to treat them anymore. So you will get some continued effect. They're not permanent. They will fade gradually over anywhere from 6 months to 2 years. Some cases they'll last 5 years or longer, like under the eyes. Other areas like around the mouth where there's a lot of movement, they'll go away a little quicker. But even in patients we've repeated 2 or 3 times, you find, okay, now they don't need so much. It's softer. Everything looks better. So you don't go all the way back to baseline, even if you waited 2 years. You always stay a little bit better than where you started because of the longer effect of these. So it does give you a longer effect than people realize. Okay.
All right. There's one more really important thing to talk about here when we talk about the facelift. It's not an injectable, but what it does is it changes the appearance of the skin itself. We've talked about the lines and the creases, and it's a new technology that you have now at the Azul Cosmetic Surgery Medical Spa.
Yeah, so it's called Halo. It's a fantastic laser system, and we have BBL, which is broadband light, which is a fantastic laser system for the reds and browns of the skin, and it does shrink pores and tightens up the skin and smooths it. And this is a non-surgical laser we do right in the office, so we've been really happy with that. That's been our most popular laser treatment for the last 10 years or more. But now we have a new addition to that called Halo, which is a skin tightening platform, so it can be done at the same time as the BBL as a combined treatment. And what the Halo will do is stimulate collagen production beneath the skin and at the level of the skin and tighten the skin, so it improves the texture of the skin, reduces fine lines and wrinkles, and helps again with the brown spots as well. So, you're adding to a great treatment that was great for the reds and browns and shrinking pores. Now we're adding a tightening element where we get tighter, smoother skin, improved texture, and improved tone of the skin. And I'm really thrilled about this combined treatment because it's really minimal downtime. I do a lot of laser resurfacing in the OR, and for patients with severe sun damage, that's a great one-time only treatment. And those technologies have gotten better every year, but this is a great treatment for somebody who doesn't have downtime. And, you have a few days of redness and swelling with that. We put you on a special topical, but you really don't need to be kind of housebound during that time. You can function pretty normally during those first few days as it's healing. And so it's exciting because it gives us really meaningful long-term results without significant downtime.
Now, is this a series of treatments? Can I do it once, or am I going to need to do it every couple of months initially to get the full effect?
Yeah, so our protocol right now is 2 treatments separated by a month. So, the first treatment, you do a BBL Halo together. It's all done at the same time. And then a month later, you come in and have that same treatment repeated, a BBL Halo, and that's it. And then, obviously, you're getting meaningful results in terms of the, elimination eliminating the browns, getting rid of the reds, the vessels, tightening the skin. So at that point, you're probably going to want to do a maintenance treatment about every 6 months to keep it looking good. Again, this is a no downtime treatment, so it's not, you don't have to block time off work to do it. And it will help maintain good tone and texture to the skin and keep the reds and browns away. So it's good maintenance treatment.
Is it like an applicator or a wand or something that is rubbed on you or placed in specific locations? How does it?
Yeah, the one is actually a contact handpiece, the BBL, and the other delivers the energy, just off the skin. So they're both done topically, but it's minimal. Well, the BBL, you feel that a little bit like a rubber band snap. The Halo, because they have a cooling apparatus that's used with it, there's very minimal discomfort with it, which is great. So it's, I always say like the perfect technologies are ones where you can get meaningful results with little or no downtime and little or no discomfort. And this fits all three parameters.
Nice. Okay.
I won't say no discomfort, but it's it's very tolerable. And, most patients find it to be, very, very tolerable. It's not a real uncomfortable treatment, which is key.
Okay.
And you do get really good results, and you don't have much downtime. So that's kind of critical.
So if I was going to combine this then with some Botox and fillers, what would be the ultimate? Would I do the Halo and the BBL first, or would I go ahead and start with the liquid facelift, or does it matter?
It doesn't really matter.
Okay.
But once we've done fillers, you want to wait a couple of weeks, and we don't really know the effects of some of these lasers, whether they could cause a resorption of some of the fillers. So, you can do, ideally, I guess, doing the Halo BBL first and then doing the fillers and Botox after. Or, if you do the fillers and Botox first, you just wait 2 weeks and then you can do the Halo. So it's not any different in the long run in terms of your result.
Okay. And then the Halo, again, is getting rid of for people who may like, okay, tell me again, it tightens, it makes the appearance of the skin look better, and it helps get rid, when it's with the BBL, of the browns and the reds.
It helps more with the browns and reds too. So it gives you a better effect in that regard. And it tightens the skin, so it gets rid of wrinkles. That's the biggest
key.
advantage.
Yeah.
So really, the BBL is reds and browns, does improve texture of the skin, but you add the Halo, you get a significant tightening, and so that really is exciting, because then we're tightening the skin, reducing wrinkles, as well as improving the texture and getting rid of reds and browns. So now we're talking about meaningful differences.
Yeah, definitely.
So like I said, the non-surgical platforms are just getting better every year. They're not going to replace surgery at this point, because there are still things you can only get to with like a fully ablative laser, which is the ones I do in the OR, but every year it gets better. The gap gets narrower, so we're seeing improvements.
So if you want to find out more information about anything we talked about this morning, the liquid facelift, the Halo, the BBL, the best resource is to go to azulbeauty.com, and so much information is on there. And then once you do that, just give Dr. Flaharty's office a call at 239-415-7576. 239-415-7576. He has offices in Fort Myers, Naples, and Bonita Springs. Set up a consultation and see what'll work for you as far as making you look younger and feel your best.
Have a good morning, Gina.
I will, and we'll see you next week with Look and Feel Your Best. For Dr. Patrick Flaharty, I'm Gina Birch. Thanks for listening.